So our next presentation is from Cheryl Hennen. She is the Executive Director of Long-Term Care Ombudsman's Office. So if we want to upload her slides. And Ms. Hennen, do you want to introduce yourself? Welcome to the committee. Thank you for joining us today.
Good morning, Chair Schultz, and thank you for inviting me. I am Cheryl Hennen, the State Long-Term Care Ombudsman. I have met some of you and appreciate spending this time with all of you and look forward to touching base with all of you. I also want people to know you will have my contact information, and I'm certainly open to connecting with you at any time. Next slide, please. This slide contains the mission statement of the Office of Ombudsman for Long-Term Care. Also, you may have received an electronic copy of our brochure. And I assure you that I take very seriously the fact that we do work to enhance the quality of life and quality of services for people who receive long-term care services. And we do that through advocacy, education, and empowerment. Next slide, please. So here's a brief history. It could be a full day type of in-service, but this gives you a snapshot. I started with the office in 2004. I worked in the region. I had an assigned region within the metro area. And I have to confess, prior to coming to the office, I myself struggled with even correctly pronouncing the word ombudsman. And throughout my career with the office, it's very clear how important it is that within the Older Americans Act, enshrined is the mandate for an ombudsman program to be in every state. And as you can see, this goes all the way back to the term ombudsman goes all the way back to the year 1809. Without reading every word on the slide, I wanted you to know, where did this start? Well, basically started within President Nixon's administration, where Dr. Arthur S. Fleming, who served as the Commissioner on Aging, was very clear about the concerns of the conditions, the very deplorable conditions at that time within nursing homes. Ombudsman program started as a demonstration project. There was enough success to shift to establishment of expanding the program. And as I mentioned earlier, in 1978, amendments were added to the Older Americans Act that every state should provide ombudsman services. Next slide, please. Legal authority and governance. The Long-Term Care Ombudsman Program is a program of the Minnesota Board on Aging. We advocate, we serve residents living in long-term care settings, which includes nursing homes, assisted livings, certified board and care homes, the Minnesota Veterans Homes, and Medicare beneficiaries receiving services in their home. So we do have a defined scope of authority. For those of you who are interested in reading where in state and federal law all of the ombudsman program mandates exist, I give you the citations. As I mentioned, we're administered through the Minnesota Board on Aging. The Board on Aging is my governing board. This is a 25-member governor-appointed board. My office, the central office, is in St. Paul, 3 blocks down from the Capitol. It's in the Department of Human Services building, although the program is not a program of the Department of Human Services and must not be. This is part of federal law. We must not be a part of any entity that provides services or regulates services. So, but every state must establish a state unit on aging. In Minnesota, it is the Board on Aging, and the administrative support is provided by the Department of Human Services, which, by the way, in most states, this is a common structure. We do have regional offices throughout Minnesota, and we also have certified trained volunteers. Next slide, please. This slide shows you what type of funding sources the Ombudsman Office has. So you will see 47% of our funding comes from the federal government. 12% is CARES Act funding. 35% is state funding. The green, if you are able to see that shade of green, 2% of this is, I have listed MHM, that stands for Moving Home Minnesota, which is really money follows the person. And this was mentioned earlier as Representative Liebling talked about the fact that Minnesota is quite a front runner for making sure that we provide, or that we have people's choice primarily be living within their homes, within their communities. The money follows the persons is a rebalancing funding, rebalancing long-term care services for the community. And in Minnesota, Moving Home Minnesota is within the Community Supports Administration. We were approached by this entity to work to develop a self-advocacy curriculum for residents living in long-term care settings. This curriculum is designed to not only educate people on rights specifically related to living in lesser restrictive environments, but also to understand what it means to feel self-empowered. So the the 4% is RFACE. And what does RFACE stand for? RFACE stands for Resident and Family Advisory Council Education. Minnesota Statute 144A.33. If you were to look that up, this is the statute that directs funding to the Minnesota Board on Aging to provide education to resident and family councils. And within the statute, it does list the entities that should receive this type of education from our office, and what those educational topics may look like. This funding is, we garnish this funding from, there's a $5 charge per each active nursing home bed in Minnesota. And that is what makes up the RFACE funding directed to our office. Next slide, please. Oh, before we go there, I am so sorry. Can we go back? Thank you. I want to acknowledge the 35% state appropriation, state funding. So you will see, because of the support from especially members of this committee and others in the House of Representatives and senators in the Senate, today I will be talking about the state budget appropriation. So I wanted to acknowledge as a preempt to what you will see in slides to come. Next slide, please. Person-centered client advocacy. The Federal Older Americans Act mandates that residents have access to advocacy services on a regular basis, in-person presence. We are very unique. We are what I will call the boots on the ground. your boots on the ground. I am here to represent the voice of residents in long-term care settings. And much of what I share is based on the investigations. We do investigate and resolve complaints that relate to the health, safety, welfare, and rights of residents. And what you will see is there is no income screening, there is no citizenship requirement, no referral requirement, and we welcome calls from residents, family, friends, facility staff, and others. And it's a free service. Also, this slide does indicate for you what the Older Americans Act actually mandates that we do, including making recommendations to state and federal agencies, to the legislature, to Congress, and to others to improve the quality of life of residents. I do serve and represent Minnesota at a national level and have also the opportunity to provide input at the congressional level. Next slide, please. So here are facts important to remember. What do we not do? So the regional ombudsman staff, including people in state office. So the state office staff is made up of myself. I do have 2 deputies, as well as policy specialist, a data specialist, and a volunteer coordinator. So what we do not do is we do not conduct licensing and regulatory inspections or investigations. However, we do provide input to licensing and regulatory inspections. What that means is the surveyors from the health department, prior to going in, they contact our office and we provide information. We do not perform adult protective services or investigations or provide direct care to residents. I want to specifically focus on the right to confidentiality. So many people, when they contact our office, they fear if they report, they fear retaliation. They want to remain anonymous because most often, unfortunately, they are reporting bad things that have happened. What's very clear in the Older Americans Act and within our regulations is a strict adherence to disclosure of Ombudsman program information, disclosure of resident identifying information, as well as if the person who is filing the complaint is a representative of the resident because they are unable to speak for themselves. And also what's important for people to understand is we are exempt from mandated reporter responsibilities. For what reason? It's for this reason. In order to protect the identity of individuals. Of course, if someone were to give consent, we would do that. And there are specific provisions within law that allow us to report abuse in certain situations so that you understand we would not be complacent and turn our backs to abuse should we be aware of it. Next slide, please. So here is where I want to focus on a certain, the Elder Care and Vulnerable Adult Protection Act 2019 legislation, I believe was one of the most important pieces of legislation that Minnesota worked together on to make sure would include very important provisions of resident rights, for resident rights. We all know that Governor Walz signed this legislation May 22nd of 2019. So many great things exist within this package. What I will focus on today is the package did include increasing staff to the Ombudsman's office. I want to share with you that the national ratio for ombudsman, one ombudsman to, and they use the active bed terminology, The national average should be 1 regional ombudsman to 2,000 active beds. That's part of a study that was conducted in order to arrive at that recommended ratio. Prior to the budget appropriation, we were at 1 to at least 9,000. How do you make sure presence is available? How do you make sure advocacy services are available at 1 to 9,000? You will see on this slide that I do provide our contact information. We do have 3 people who are live answering intake calls every day. I want to, next slide, please. Okay, so this is every number represents a regional ombudsman location. This is pre-budget appropriation, Greater Minnesota. There's 9 numbers on that map. Next slide, please. Here's the metro area, pre-budget appropriation. Very, very dense part of our state. 5 locations. Next slide, please. I am so proud to share this slide with you. This is current. It was my goal that we would take our budget appropriation money and invest it back into our communities, back into our region, the boots on the ground, the people in the facilities, to the greatest extent possible that I was able to do so, to reinvest back into reaching our people. That is what you wanted me to do, expected me to do, and we're doing this. We're doing this during a pandemic, during a hiring freeze, by the way. I did seek exemptions to the hiring freeze. I obtained them, and we are moving. Current Greater Minnesota map. Next slide, please. And here's the metro. So what we have been able to do, the budget appropriation included 9 regional ombudsmen and 1 deputy. So we have 1 more regional ombudsman to hire, and that will be in the Rochester area, and we will have fulfilled that particular responsibility of the budget appropriation. I am just so grateful to all of you legislators who supported this budget appropriation to expand advocates throughout the state of Minnesota. The budget appropriation also included 1 full-time employee to work on electronic monitoring and other ombudsman legislative activities. As you may know, within Minnesota law now exists the right to electronic monitoring. Also, the budget appropriation included 6 additional support staff. So as I told you, I've added staff on the intake line for being live, hoping that we can reduce the number of calls that are missed or go to voicemail. We're also working on more staff to accommodate support to the regional staff. Next slide, please.
I'm going to stop you there, Ms. Hennen, and we have a question from Representative Keel. Did you want to ask your question now, Representative Keel?
I can now, or wait until Cheryl's done.
It's up to you, Representative Keel.
Okay. Well, she answered part of my question earlier. I was wondering, how easily it has been in this hiring freeze or this hiring situation to be able to find people. And it seems like you're not having trouble with that. Is that what I understood, Ms. Hennen?
Ms. Hennen?
Madam Chair, Representative Keel, hello, by the way. So as people get to know me, I'm very persistent. I will not stop. And so we have compelled we've went through our process, we've obtained our exemptions to the hiring freeze. And what is so amazing is the number of people who have responded, particularly to applying for regional ombudsman positions. I've had some less amount applying for policy position or the electronic monitoring. And I'm glad that you asked the question, because it's very important to me to also expand the diversity within our office. And so we have also paid close attention to equity and inclusion. So I'm grateful. We have not had much trouble with the hiring pool.
Thank
Madam
you.
Chair.
Yep, Representative Keel.
Thank you. I'm glad to hear that, because with all the difficulty in hiring, and I can see where this might have been a problem. And I would like to share with you, Cheryl, and actually the committee. We talk about all the stress that gets called in, the icky stuff that gets called into the Ombudsman's office. But I want to share with members that we went state to state. I had the family in my district and the parents in Albert Lee, but they were separated. And during COVID, could not see each other. They were going to be celebrating their 60th wedding anniversary. And while the Ombudsman could not get them together on the day of their anniversary, they are now in the same building. And the family was just very relieved at the work that you did, and very appreciative of the fact that you and your office and the Ombudsman in that area was able to be successful. And I just really appreciate that, because we think of reporting the challenges to protect people, but there's also just life issues that need to be handled. And I appreciate what you've done there. Thank you.
Thank you, Representative Keel. You do important work, Ms. Hennen, so we're very grateful that we're able to bipartisanly approve more positions for you. And I know you're going to continue to do good work for the people of our state. So if you'd like to continue your presentation, please do so.
Thank you, Madam Chair, and thank you, Representative Keel, for sharing that experience. I will come back to this committee at any time that I am invited, but I have a whole host of examples that will show evidence to the problems that are out there, but to Representative Keel's point, how we are able to make life improved, and also to consider the cost savings in terms of when you improve people's lives, they may not need more intrusive, expensive care. But we must never minimize what happens to the well-being of people when they are separated and cannot be connected. And I applaud you, Representative Keel, because you were such a good advocate for this couple that wanted to be together for their wedding anniversary. So many people did not spend wedding anniversaries, funeral time together, graduations, the list goes on and on and on. So I promise to try to stay within my time frame. Please, Madam Chair, let me know when it's time to kind of move on. But I will also say that there are very good stories out there. This slide here is I had to make the very difficult decision in March to temporarily transform Ombudsman services to a virtual presence. And I did so in order to do our part to mitigate the spread of the COVID virus. And so we have been working, yes, but we've been doing so virtually up until October. And the slide does list what did not change. And what I want you to also understand is my commitment to ensure that we are also tracking and recording emerging trends. Next slide, please. So this picture was actually sent to me. I believe it was April, May, and it was very troubling. And it was not sent to me for a sensational type of fact. This was actually a nursing home resident who put this poster in their window, and on the bottom that's cut off, it reads, "Set us free." And it is a very much a symbol of how residents report to us that they feel like prisoners, yet they are not prisoners. And I share this with you because I know all of you are very aware of how COVID-19 has affected people in long-term care settings. So to receive something like this for me was quite symbolic, but yet very, very sad. Next slide, please. There are a number of trends that are emerging out of COVID. So I will touch on the top three, but there are more. As we've mentioned, it is no secret that one of the biggest challenges for people has been the restrictions on visitation and people separated from family members and loved ones. Visitor restrictions placed on people since mid-March meant to protect them reveals unfortunate consequences that isolation and loneliness creates. What's being reported to us from residents is there's nothing to do here. I am isolated to my room. There are not enough staff to get the work done. We've heard from many family members because also people in memory care units are particularly vulnerable to the isolation effects that COVID has created. So not only do we see the high death rate that COVID-19 has wreaked havoc, but we also know that people, particularly in memory care units, have suffered greatly from the isolation. And through tears, we know that many people are reporting to us that their mother, their father no longer recognizes them. And also, what we did have much work on, of course, is making sure that if people cannot be together, that they get to place a camera. The law about electronic monitoring, we do know that people were able to get cameras placed during this time. We have family members that really, pre-COVID, they were the people providing the care through their consistent visits. So without that, what we were able to see, unfortunately, is first of all, at least half of our calls have been about isolation and loneliness, but also, unfortunately, many reports were received about the neglect of care, such as missed meals, missed personal cares, and injury. Now, I will state to you, there are many good providers out around the state of Minnesota, and we must commend all of them for daily. They show up. Daily, they do show up. But we also have to acknowledge that there are problems. Transfer discharge. So what I share with you on this slide is complaint comparisons from, so this is federal fiscal reporting year, 10/1/2019, 9/30/2020. You can probably tell I'm right in the throes of the federal government reporting right now. We are putting our federal report together. 445 increase of reports of transfer discharge from 178 over last year. 244 of the 445 complaints occurred since COVID-19. Another 70 discharge complaints received from October 1 through December. The good news is Governor Walz issued the Emergency Executive Order 2014 on March 23rd, 2020, which prohibits property owners and landlords from filing eviction actions and terminating residential leases with only narrow exceptions. So this order is the primary reason that we have been able to stop any involuntary transfer discharge action. So this keeps people in their home. We also, this is where I have been pleased with how we have worked with other state entities, state agencies, such as the Attorney General's office, in order to prevent people from being involuntarily transferred, evicted, some to the streets. And this emergency executive order has prevented a lot of that from happening. Staffing, we heard from the health department about staffing. Certainly, COVID-19 has greatly exposed the problem of inadequate staffing. We receive so many calls from people. They worry about not enough staffing. They worry about the staff themselves becoming sick. I will suggest to you that I do see that this is an area where we all have an opportunity to come together and work together and figure out what we can do to improve this. Frontline staff in long-term care settings do need better support. Residents cannot survive without adequate, sufficient staff. And this is a conversation happening also at the national level. I suggest to you, we do need to see improved wages and guaranteed benefits such as medical and sick leave pay. We are hearing trends around the state that more residents are saying yes to the vaccine and less staff. And part of that reason is they worry that they will become sick. This is what staff report to us. They will become sick from the vaccine, therefore not be able to come to work, and they do not have medical or sick leave pay. So that's because we too are asking the question, why so many staff as compared to residents are not receiving the vaccine. Next slide, please. In conclusion, I leave you with my recommendations for today. We need to organize our care systems around the people who live and work in long-term care settings to enhance quality of life. We need to focus on equity and inclusion, free of discrimination. We need to continue to support and allow residents of long-term care settings regular in-person contact with loved ones of choice during the COVID-19 pandemic. And here is another area where I report to you that we do more together than apart. And so the Ombudsman's office has played a very important role in working with our partners, including our partners in the Department of Health, in terms of ensuring that we balance safety with allowing people the right to visitors. Staffing, I've already talked about staffing. I also support the fact that we need to continue to assure access to adequate PPE, COVID testing, and lastly, uphold the commitment to transparency and regular communication. There is a resident advocate newsletter that is written for and by residents of long-term care facilities. And a common theme in that newsletter since March has been that in the midst of all of this, what is one important thing that you need to be doing? And that is that we need to stay connected. We need to be able to ask questions, and we need to be able to receive answers, the right answers. And I'm here to tell you that I am committed to being transparent. For example, how are we spending our COVID money? I'm also here to tell you that I'm committed to a regular communication with this committee in order that you know what is happening on the ground, what is taking place. Some very amazing people live in our long-term care settings, and I know that you all know that. Next slide, please. I wanted to end with a glimmer of hope, because I am receiving calls from residents, and it's probably the hardest call to take. And that is people saying, please tell us this will end. They actually call me and ask that question. This is no exaggeration here. Through their tears, please tell us this will end. Please tell us we will not live like this forever. And the answer is no, we will not live like this forever. There is hope. Minnesota is a front runner. Minnesota is a leader. I will tell you this from a national level of state ombudsman. People look to Minnesota. What is Minnesota doing about visitation? What is Minnesota doing about vaccinating and making sure everyone is vaccinated? How are you prioritizing? So we are looked to for what are we doing here in the state of Minnesota? But we must make sure that we are constantly looking for how people are doing within our long-term care settings. And I do want to leave you also, there's ombudsman staff are resuming in-person presence. We did start with outdoor window visits in October, and my staff are starting to go back into the actual settings themselves with our safety as our guideline. I wanted to leave you with some positive resident feedback. I'm kind of going to skip around the state, and I don't have enough time for all areas, but Rochester, the Rochester area, within the Rochester area, residents report the vaccine that's being administered, it's going well. It's like thumbs up. And administrators are very excited. However, more residents are consenting to the vaccine than staff. Within the metro area, facilities are sharing their plans about vaccine distribution. What we are seeing is questions about if a person is going from the hospital to a nursing home for transitional care, which means short-term stay, they want to be vaccinated. However, the facility has already completed their vaccination. But what we are seeing is physicians from the hospital and staff are stepping up and saying, we want this individual vaccinated. They are in your setting. Tell us what we can do to help. So it's crossing over and working together. Northwest Minnesota. It was amazing because I asked all my staff to send me reports of what they're hearing. And so the list of facilities that actually are receiving the vaccination. Again, more residents than staff are being vaccinated. What we are seeing in some areas is more staff are needed at some locations in order to monitor the residents, because people must be monitored for a certain period of time after they get the vaccine. So I see that as hope, but there's still a lot of work to be done, right? Because there's a lot of information happening and changing every day. We are receiving many calls from people who live in senior high-rise independent living settings, asking us, I'm over 65, please, when can I get my vaccine? Or people living in independent living apartments within a continuing care campus. So there's independent living, assisted living, and skilled. They see people on their campus vaccinated. Can we be vaccinated, please? We also are hearing of people who are in independent living and somehow something happened along the way, and all of a sudden their groceries are not being delivered to their doorstep, and they're in need of it. So ombudsmen have actually reached out, and we are making that happen. We are even making sure that people are getting their groceries at their doorstep as they were. My staff are doing excellent work. It's not easy. We are at times, we meet on a regular basis because pandemic fatigue has set in, but we are doing well, and we are getting much work done. With that, that ends my presentation. Last slide will show you my thank you and my contact information.
Well, thank you, Ms. Hennen, and we're so grateful for you and your staff. You are doing wonderful things for the people of the state. And you've highlighted many issues that I hope our members will start working together and tackling. And thank you for highlighting all of those issues we need to solve as a state. And it's good to hear that Minnesota is leading the way and people are looking to us as we tackle the COVID pandemic and other issues in long-term care. And I see that Representative Albright has his hand up. Representative Albright.
Thank you, Chair. Ms. Hennen, I'll be quick because I know the time is limited. First is just a request for a definitional difference between a long-term care facility, of which you describe yourself as the ombudsman for, and how does that contrast with an assisted living facility? There is talk about the plurality of those, but I'm hoping that you can provide a distinction between the two for us. And I have just two quick follow-ups, Madam Chair.
Okay, Ms. Hennen.
Madam Chair, Representative Albright, thank you. That's a very good clarifying question. I'm glad you called that out. So within our scope of authority is nursing homes. It's defined as nursing homes and other adult residential care settings. So assisted livings fall within other adult residential care settings, even though to some people, we know some assisted livings have memory care units, and people who live within those units meet skilled nursing facility level of care. We could have a long day, and I will not do that to you, but in order to define a distinction, also assisted living is in most cases a lesser restrictive living environment. And so the way we look at this is long-term care settings include nursing homes, and then assisted livings fall under a category of other adult residential settings. I hope that makes sense.
Yes, thank you.
Representative Albright.
Thank you, Madam Chair. Ms. Hennen, I'll couch the last two questions together so that you can respond. You mentioned in one of your needs on one of the slides in your deck, a need for additional frontline support staffing. I'm wondering if you could articulate what types of frontline staffing are needed. Is that RNs? Is that CNAs? What type of frontline staffing deficits are we facing? And then you also, on one of your very last slides, said that we want to organize, or your desire is to organize care systems around the people. And I'm just asking for your depiction in terms of what does that mean and what does that look like? And I'll end there. Thank you.
Thank you, Representative Albright. Ms. Hennen.
Madam Chair,
thanks for offering. I've got several in my briefcase already.
Go ahead, Ms. Hennen. Sorry about that.
That's okay, Representative Albright. Very, very good questions. So I will start with your last question, which talks about organizing our systems around people. And so what I mean by that is it's really been a transformation over the years to move from a medical model to a person-centered model. And any of us who may have accessed the healthcare system, particularly with people 60 or older, understand that those systems may be more built around clinical, medical, instead of putting the person first. and acknowledging who the person is, what the person's needs are, and what their preferences are, and listening to them. All of us know that too often ageism reaches inside, and there are particular ageism, racism, there are so many things that assumptions are made and the person's voice is lost. So that's where I'm going with that. And you raised such a good question about staffing. What do I mean by that? According to CMS, which is the Center for Medicaid and Medicare Services, the national average of certified nursing assistant hours per resident per day is 2 hours and 23 minutes. The federal government studied this issue and concluded that residents need 4 hours and 6 minutes of care per day. That translates to 2 hours and 48 minutes from a certified nursing assistant, 33 minutes from an LPN, and 45 minutes from an RN. This is the minimum amount of care needed to prevent pressure ulcers, dehydration, losing the ability to carry out tasks. So I quantify that for you to understand how that covers our frontline workers. At a national level, there is advocacy to increase the certified nursing assistants. But I think in Minnesota, we really need to take a look at our data and really understand, what are we talking about? All of the frontline, or where do we start? So your question is very welcomed.
Thank you, Ms. Hennen.